Yo, what's up? I'm QX and Terry, and today we're live with the Redox API Hour, and we have LT, Devin, Nick, Hat. Where's the hat?
You're looking at him. You're looking at him.
So we're going to talk about blockchain today, and I'm going to start off the conversation. Everyone knows about blockchain here, right? Do we not know about blockchain?
We do.
All right, any questions? Because the questioning starts after this. So if you don't know about blockchain, clear it up now.
You asked the questions.
All right.
Today, not
So with the blockchain, and we're looking at it from a healthcare tech, health IT perspective, who should have access to the chain and why? So that's the question I want to know today.
Yeah, that's an interesting question because there are a couple different ways it can be done. With Bitcoin, the model is anybody has access to the blockchain.
Right.
In a hospital setting with PHI involved, that potentially is a lot more risky.
Correct.
But as soon as you limit access to the blockchain to a small group of people, you lose a lot of the benefits of the blockchain, which is that any third party can validate what's going on and can see audit information trail, basically. So really, neither way is quite perfect, but there are solutions that are trying both attempts. To have it completely public or to have it be protected and only accessible by members of certain organizations.
So taking like the original blockchain analogy, following the Bitcoin analogy, do you feel like if we were to bring it into a health setting, do you think that it should be driven, or access to the chain should be driven by the providers or the patients? And anyone can chime in here.
Well, I feel like that really the only redeeming quality of blockchain relative to where we are right now in the industry is that it's introducing at an infrastructure level a federated model of healthcare management. And while blockchain itself may not be the eventual tool, like I think in general we should be excited about the concept of a patient being the broker and a highly decentralized management of healthcare data, which will eventually mirror the decentralized management of healthcare itself. So to me, the patient, if it's a provider tool, it's a less effective provider tool than what we already have. The only redeeming aspect would be if it's a patient managed, patient monitored.
I build on that and say that part of the reason why blockchain exists is to facilitate exchanges between two parties that don't trust each other, and in general, in the healthcare setting, providers trust one another, and there's just a different trust mechanism in place than it exists in financial industry and basic financial transactions. So there may be that lack of trust in terms of a patient versus provider, in terms of not knowing exactly who's on the other end of that patient information.
And our current state is not one where we have a problem of trust.
Mm-hmm.
It's a problem of not having any connections to each other at all. We might get to the point where we have this problem of, not knowing who has the most up-to-date records for a patient, but at this point we can't even get records from other health systems.
Mm-hmm.
So with the patient having, I guess everyone kind of agrees that this allows for the patient to be brought into the mix. And the question I have from that is, what type of control, or what type of, or if it's not the patient, the person that we've designated to control that data, the patient data, what type of control do they have to the chain then? Do they have control over all of the metadata that they place in the chain, or?
I actually think that you made a jump that blockchain hasn't been able to address yet, and that is that just because it's decentralized doesn't mean that the patient is involved. Patients aren't going to be nodes on the blockchain, on any blockchain. It's going to be somebody else, and that's a gap that I think still has yet to be filled, right? If my health data is not on my device, it's at the hospital's device, that distance is the same on whether it's on the health system's device or whether it's on 25 other people's devices, right? I still have a distance to where it's being stored, and blockchain doesn't address that. So I think that healthcare advocates of blockchain in healthcare space are already making the jump from health system silo to patient nodes on blockchain, and I don't think that is how it would actually fall out.
So you make an interesting point there. Who should govern this blockchain if there is going to be a healthcare blockchain?
I think
Governing a blockchain is not really possible.
Yeah. Very
Because of the decentralized nature of the blockchain, the only thing that really governs it is the consensus of all of the peers that are involved.
So with the Bitcoin chain, I guess So with the Bitcoin chain, the rules were kind of set, and everyone kind of commonly agreed to those rules. I guess the question I'm wondering here is, we don't have anyone to make the rules for the healthcare chain. So who are we going to trust to do that?
Yeah, that's a really good question. And especially because with Bitcoin, the way that the Bitcoin blockchain is set up is fairly straightforward because it's basically just for exchanging money.
Right.
But if a blockchain was to be used in healthcare, it would have to enforce significantly more complex rules or business logic, as you'd like to call it, in order to validate whether or not a transaction is correct. So exactly what that business logic is, how you could validate whether or not this is a correct and valid health transaction, whatever that means, is really, I think, still up for debate, and a very hard problem that's going to need to be tackled by whoever wants to create a real blockchain solution for healthcare.
Well, you brought up a good point that the financial market is able to adopt a tool much faster. Like, just look at the API versus HL7 situation that we have now, where people that are coming into healthcare from finance or retail come into this like wasteland of interoperability, and they're like, how on earth have you guys not figured out yet? Like, we figured out how to exchange money years ago via an API, and you're like, it's just not the same, right? There's fundamental organization, data level reasons why it's different, and I think we would definitely see the same barriers of blockchain getting adopted. I'm not surprised that finance was the first one in, because it's such a limited subset of metadata that has to be governed and controlled as opposed to healthcare.
So for existing HIEs and networks, how do you feel like the blockchain will coexist, or will it, be predominantly?
I think that probably the first place that we'll see the blockchain used, the place that it could most easily be integrated into the existing system, is just to replace kind of our centralized data silos sort of storage model that we have now, where a hospital will have a couple databases that hold all of its PHI. And those databases are a significant point of risk for the hospital. And I guess there have been cases of ransomware happening in the past where hospitals have been forced to give up that information or pay a large fee. And with the blockchain, that's not really possible. The hospital isn't even able to divulge information in the blockchain without permission of the patients who are involved. So that kind of ransomware would be impossible.
But at the same time, who's responsible for administering who gets access and who doesn't get access to the chain? Because once you have access to the chain, you still have access to all the data in the chain.
Not necessarily.
If it's permission if it's permission based, or for the private chain, not true. But in the blockchain, not true.
Yeah, well, it's true that you wouldn't want to store all of the information in the chain.
Right.
But there is blockchain, depending on the blockchain implementation, it heavily uses public key cryptography to ensure that people can only view or modify parts of the blockchain that they have access to.
Right.
So for example, in Bitcoin, I can see, but I can't modify the contents of somebody else's wallet.
True.
So there's that kind of enforcement there. And then I think that as far as how we limit people's access to the blockchain to be able to simply read the data, is still kind of an open question. And that's the reason that if you started out just having it inside the hospital, replacing a database, and having it, integrated into all the different nodes in that hospital, all the different computers in that hospital share the information instead of storing it in a centralized place. And then only the people in the hospital, or only, certain authorized users even, could have access to that blockchain.
But that blockchain is not strong then, because, it's only the devices that are within the hospital.
Yeah.
So is it worth using a blockchain in that scenario?
It definitely wouldn't be the panacea that it would be if you had a public blockchain.
Right.
But it would potentially provide some benefits, mainly against like that ransomware issue, or, it makes it a little hard for database outages to occur.
Okay.
Fundamentally, the purpose of the blockchain is to try to ensure that data integrity happens even when you have multiple different clients who are doing things at the same time, which is, a hard problem that's definitely applicable to hospital settings.
Nick, I'd be interested in your insights on this as well.
I think what a lot of people are missing is just that, even the fact that you went to the doctor is a piece of PHI. If there's any kind of public blockchain at all, my first goal would be to go find Donald Trump's ID or whatever, however he's indexed in the blockchain,
right?
And figure out when all his last appointments were. I think it's just the hackers'
choice. Curious choice.
Yeah. You're number two. Thank you.
thought I would be number one, but no. Not at all.
But yeah, it's really kind of scary. I think a lot of people who make decisions are going to be scared about it, and the value add is not really there.
So one of the interesting use cases, so I think definitely anything that comes back to really identifiable and potentially sensitive information almost always leads itself to this conversation of a private chain where what you're storing is a hash to some other data store. But there are some other areas, and this is why I'm so interested in advanced directives and maybe a couple other use cases, is that's information that when anonymized is really just a contract. Just being able to see, account 123 has a do not resuscitate isn't really that unique or that identifiable. But having that available publicly and then reconcilably eventually could be useful and could be public because it's not necessarily doesn't tie you to a particular visit or to a particular diagnosis or problem.
I think another interesting use case is the amount of data that we collect that once anonymized is still highly valuable. So you're looking at what we know as a registry or like a cancer tumor list, that it's fairly arduous to get that data into a centralized repository, and it's very difficult to curate that list because of all the different data points that are entering into it. A blockchain wouldn't need to know the patient name or any identifying features about the patient. This tumor came from a 29-year-old male. Would be enough to make that a highly valuable group sourced piece of information. And so to me, the concept of a blockchain, we're all trying, the whole industry is trying to find solutions to these macro problems, right? Like ransomware patient events are 10x higher between 2014 and 2015, and it's higher even this year. And I mean, we're going to be looking for solutions to that. I don't think blockchain is going to solve like that problem for a lot of the reasons that we already brought up. Mm-hmm. But I think buried in that technology, there are some pretty innovative use cases that are going to start out really small at a micro level, and then are going to grow pretty rapidly. And I agree. I don't think it's a trust. We're not solving a trust problem here, but I do think we are solving an accessibility and a group share, group curated problem.
So the last question I have is, how do we align the blockchain with existing privacy control that we kind of have mandated with HIPAA and, the legal gap that we also have when dealing with patient data, right? This is a serious issue. And I mean, we can hash data and store it in the chain, but that defeats the use case of the blockchain.
Yeah, the blockchain itself doesn't really have a lot of privacy features involved in it.
Right.
It's not designed to, it's publicly auditable. But there are additional technologies that people use kind of in tandem with the blockchain or are talking about using with the blockchain in order to kind of add an additional layer of security on top of it. For example, to encrypt data that's put on the blockchain in such a way that you can only decrypt the data with the permission of the person who owns it, which typically is a patient. The patient, would be identified using their own cryptographic key. And using that cryptographic key, they could authorize hospitals or studies or whatever to access their PHI in certain ways. And this kind of gets into what people call smart contracts, which are contracts that are bound by code and also by law. And so sort of by using smart contracts and by using algorithms that allow people to do shared computation without actually sharing data, which is a very fascinating concept. Like you can calculate average blood pressure without anybody actually learning the blood pressure of anybody else. So those kinds of things kind of allow us to build a layer of privacy on top of the blockchain. But exactly how that would work in the healthcare industry is not yet completely clear.
Makes sense. Any last thoughts?
I think one of the key problems that we haven't really talked about yet is having that identity type thing. You don't have a national patient identifier, so any kind of blockchain use is going to be somewhat limited in scope. You can't have a national blockchain unless you can uniquely identify patients. The Netherlands, for example, has these little smart cards that everybody has, which is actually a pretty user-friendly way to have public-private key encryption done. But I don't think you're ever going to get that done in America, so I'm kind of pessimistic about it.
Okay.
The other interesting thing on basically tying the patient to a single patient to a unique public key is that chronologically you could potentially, if there was a public chain, you could chronologically potentially identify a patient based on a series of visits, and then extrapolate that forward. So I think there'd also need to be another abstraction layer on top of the identification of a single account or a single patient beyond just their public key, so that you couldn't say, I know that my ex-wife went to the doctor this time, and now I'm going to track her forever forward on that account or something like that.
Yeah, and there's an even bigger problem in my mind. What I would be concerned about as a patient is if you have a master patient identifier that identifies you on a blockchain, a cryptographic key. If you lose that key, there's no way to recover it.
True.
And the hospital doesn't have it, and the hospital can't do anything with your data ever again.
And so
It's permanently lost.
a lot of people that are they're getting around that problem by using is it PGP encryption. So and then what they're doing is they're giving so if you lose your key, you basically say, hey, this person is an authorized user that can verify it's me, and then they would have like access to your key.
Yeah.
So
that's kind of like an idea of a certificate authority that distributes keys, a trusted authority that distributes keys to users. If you lose your key, the trusted authority can give you another one.
Right.
And that's definitely a model that might be very useful in the healthcare industry.
You think